Good evening, folks. Here we are for the webinar entitled ICE to See You Again, a rapid review for returning psychiatry ICE preceptors. I want to acknowledge Aria Soman's wonderful sense of humor and how she constructed that title, ICE to See You Again. This is our first time doing this as a webinar. I'll admit it's somewhat strange as I'm looking into a microphone, talking to you, but not seeing you or hearing you. So we'll see how this goes. So today, we need to go to the next slide. Here with me, this is John Young, and as you know, I'm Vice Chair for Education for Psychiatry and oversee the medical student education generally. Aria Soman here, who will be doing most of the talking, is our Director of Medical Student Education and the Site Director for ICE. Yay! Also here is Taranjeet Ahuja, and she is the Director of ICE and ACE Continuity Clinic. And Elizabeth Vasil, did I pronounce that correct? Is a coordinator. She's not here, although you wouldn't know that. I could say she's here, but she's the administrative support for ICE. So that's the ICE team, and of course your main point of contact for ICE will be Aria Selman, and you'll have email and her cell phone and all of that. Feel free to contact her at any time with any question so we can keep this moving smoothly. So let's go to the next slide, which is a colorful welcome back in a new year theme here. And really, I want to take this moment to say, in all seriousness, to thank you very, very much for your willingness to serve as preceptors. ICE is the first meaningful clinical exposure that medical students have to psychiatry. And as such, it's really, really important because this will shape for many of them will shape their future attitudes towards behavioral health, and for some will be important in terms of their specialty choice. So we have invested a lot of resources in the department, and really primarily in terms of your time to help provide a good experience for the students, because we see this as really one of our most important footprints in the overall four-year curriculum, in a way that we can directly expose students in a positive fashion to psychiatry, and hopefully really give them an appreciation for the breadth and importance of our specialty. And for the select few among them who get turned on, hopefully it can be part of that, turning them on to psychiatry to think about it as a specialty. So thank you very much for agreeing to return this year. As you may know, I've mentioned this at a couple of our grand rounds, and I think this is true. I've said it enough, I hope it's true. I believe that psychiatry, the feedback for psychiatry ICE it's been the most favorable of any of the specialties, and I'm getting the thumbs up here, so in fact that is true. And has been very well received by the students, and I think the medical school leadership's been very pleased. So we should all, but especially you, should feel very proud about that. At this point, what we're going to do is the agenda. Taranjeet's going to review the overall curriculum for the medical students, so you have an idea of where they are right now, like what's preceded in the prior year and a half, and kind of what they're doing right now. I will briefly describe the current class they're in, and then Aria will take us through the logistics as well as the goals and answer any questions. So I'll turn this over to Taranjeet.
Hi, this is Taranjeet Ahuja. I wanted to thank you all for joining us this evening for this webinar. As John had mentioned, Psych ICE is the highest rated ICE that we have, and I want to personally thank you all for making that possible. It is something that the students rave about. The reviews clearly jump out whenever it has to do with Psych Ice, and that wouldn't have been possible without your participation. So I want to welcome you back and thank you for making this the best ICE experience that we have. So the next slide, just to give you an overview, although you have participated in Psych Ice prior, I thought it'd be helpful to see visually where the students are at this point. So the first 100 weeks is the first 2 years, and they are in their final course, which is the human condition, prior to taking step 1 and beginning their 3rd-year clerkship. John will go into the human condition course, but just so you know, in the bottom you'll see the PPS component. There are 3 curricular components: mechanisms of health, disease, and intervention, which is their core basic science, structure, and PPS. So PPS incorporates their longitudinal communications course, and there's a nice description of what they learn in communications in your preceptor manual. So please refer to that. But they are trained to take a history, though not a psychiatric history at this point, but they do know how to speak with patients and communicate with them. And in the next slide, you can see these are the ICE experiences that they've had so far. So in their first year, they started off with ambulance runs, and then once their second course began, they were introduced to ICE, which is in the community setting. So they have a medicine preceptor, an OBGYN, and a surgeon, and they're assigned to go into their office for 4 hours every single week into one discipline. And then second year really focused a lot more on pediatrics, and then now they are in psychiatry. We try to integrate what offices they're going into, what discipline they're going into, based on what they're learning in the classroom. So they are starting their human condition course, which is for the most part their neurology and psychiatric course, and which integrates really nice with Psych Ice. And as you can see from the right corner slide, this has been a hands-on experience for them. We follow an anti-shadowing philosophy, and I think that's proven really well for our students because they come in pretty well prepared, interacting with patients in their MS3 year. So I'm going to pass it back to John to review the human condition course, or give you an overview.
Thanks, Taranjeet. So, and to pick up on Taranjeet's point about the anti-shadowing philosophy, so I believe that the reason our psychiatry ICE has been so successful has been because each student gets to do an interview each week in the presence of an attending and peers, and then to receive feedback, and to do that each week. And the comments that we've gotten, they just so appreciate the opportunity to be observed, interviewing, and to get that feedback and sort of practice the skills and the art in general. So I think there's an important generic contribution that this makes to their basic clinical interviewing skills, as well as getting comfortable with psychiatric patients and how to do an HPI, with a psychiatric patient. So human condition is there are, what is there, 1, 2, 3, 4, 5, there's 6 blocks in the first 100 weeks. And just to remind you, one of the very innovative parts of the curriculum is they start off getting certified as EMTs. And that's what Taranjeet, when she said they were doing ambulance runs, they're getting certified, and then they're starting to function as an EMT. And that provides them with an authentic and meaningful workplace role, clinical role, that they can draw on and use as scaffolding as they engage with the basic sciences over the first 100 weeks. So it's really, really cool. So here we are in the last phase of their 100 weeks, and it's a human condition. Last but not least, and this is the classic brain-mind behavior course done in a unique way, where there's the 3 mornings a week. They do case-based learning in small groups. They have structure sessions where they learn about brain structure, connectivity, pathology, and then they have the what do we call the PPS sessions. And basically, over the course of, how long is human condition total? About 12, 13 weeks. They're covering in a fairly integrated fashion, basic brain anatomy, structure and physiology, and using neurologic and psychiatric illnesses as the prompts by which to get engaged with that material. And they're also learning some of the basic clinical sciences as well. So for psychiatry, they're learning the clinical phenomenology around major depression, bipolar, and some of the anxiety disorders, and of course schizophrenia. Now, some of that content comes later in human condition, like in March, late February, March, or even after ICE is concluded. So we do front load this month a couple of sessions that Aria and I think Jerry is doing this year, where they will review the DSM basics for mania, depression, and psychosis, and also review the basics of a mental status exam. So they'll be coming into ICE with some background in that, even though they may not have yet formally done their case-based work with schizophrenia, bipolar, or depression. So with that, I will pass it on now to Aria, who's going to really take us through the remainder of the session, through the goals of ICE and through the structure, and we'll have an opportunity to address any questions.
Hi everyone, this is Aria Soman here, and just to reiterate what everyone else has said, thank you again for joining us today. As you've already heard about the wonderful experience that you bring to all of our students, I will do my best to take us through in a thorough but concise way as far as reviewing the structure of the ICE sessions and the general schedule for you. So first, to start, just to again give you an overview of what the goals are, which I think that John highlighted very nicely just a few moments ago. The students are going to really focus on performing a diagnostic psychiatric interview, and they're going to especially focus on being able to do a comprehensive HPI and review of systems, and they're going to be able to practice every session multiple times, the goal of developing and presenting a mental status exam. So to do that with the mental status exam, they're going to have a chance to initially document it and then to verbally present it to their peers and their preceptor. So through these exercises, our goal is to really help students appreciate, how psychiatric diagnoses are made, the various ways in which one can elicit the information needed from patients who are presenting and in different ways and with different symptoms. And they'll really have a chance to develop their skills both through their individual practice sessions, interviewing patients, and through being able to observe and give feedback to their peers as well in terms of seeing how others also approach similar situations. So the overall schedule for ICE is that it's going to take place over 6 weeks. The 6 weeks and the 6 sessions will be within a total of a 7-week period, because we will have 1 week, that's the week of February 15th, where sessions are not formally scheduled unless, for example, there's a need for a makeup session, if sessions get canceled unexpectedly, or for some of you, if you know ahead of time that you have a conflict during one of the weeks. So Psychiatry ICE will officially start the week of January 25th and will run through the week of March 7th. So each of you will have 2 to 3 medical students. I believe the majority of you will have 3 students with you. And as mentioned, you'll be meeting with them for 6 weeks in a row, for 6 sessions. So you will be working with the same group of students over the course of ICE in order to provide you and them with continuity of the experience. Each session will take place during one afternoon for about 4 hours. Typically, the sessions will start for you around 1 o'clock, and the students will usually meet you around 1:30. And it usually runs until around 5, which is why we ask you to set aside that 4-hour period of time. So the overall structure of the sessions is that each session is going to start with what we call a huddle, and I'll go into more detail shortly. Afterwards, the students will do a comprehensive psychiatric interview on a patient, and then will receive feedback based on direct observation from their peers and their preceptor. And interspersed with this, again, there will also be an exercise in terms of writing the mental status exam out and then being able to present and discuss that. Finally, each session will end with a debrief after each student has gotten a chance to go through this cycle of interviewing and then discussing and presenting the mental status exam and getting feedback. So the debrief will recap the highlights of the day, what students took away from the experience, and will also compose of a chance for them to generate some exercises to work on for preparation for the next week. Again, I'll go into that in a little bit more detail in just a moment. So the first step, of course, is finding patients. As John had said, this is one of the key components that we're going to need in order to really ensure that students have as ideal an experience as possible. So the way that this will work is that I have been working on setting up the schedule and assignment for which units you'll be located on with your group for each week of your ICE experience. So you'll be receiving an email with the final schedule of unit assignments in a pretty short amount of time in the future. It's in the final stages of being finalized, and I did actually just make outreach today as well to the inpatient team to let them know about what the preliminary schedule is. Now, the first step for each of you is that on the day of your Psych-ICE session, I'll be asking you to contact the unit attending on the unit where you're going to be meeting your students, and probably around 1 o'clock, I will ask for you to actually go to the unit and touch base with the attending in order to make sure that the patients are, again, sort of still on board for meeting with the students and being interviewed, and that they have given their consent for the experience. And we usually ask you to do this at least by around 1 o'clock, so that gives you some time should there be any unforeseen situations where patients have changed their mind, for example. And as always, if anything like that occurs, please feel free between yourself and the unit attending to please give me a call or contact me so that I can help out. So once that's been taken care of, you'll be meeting your students by 1:30 at a location that's been pre-designated by yourself. You'll be asked to, be in touch with the students that you're working with in advance of the first session so that everyone knows when and where to meet. So now, just to go into a little bit more detail, as far as the huddle, typically, on most weeks, it's going to consist of reviewing assignments from the previous week. Now, of course, on the first session, rather than doing this, it'll be an opportunity for you and the students to get to know each other, to sort of review, again, what the structure for the sessions are going to be, and for all of you to, again, sort of really review what each student's, their interests and who they are, so that all of you feel comfortable working together. And then, including the first session, once the initial orientation has been completed, usually the goal is to allow the students to self-identify what their goals are for today. So an example of that would, again, be what's quoted here on the slide, literally asking them, what would you like to work on today? And again, as Taranji and John both mentioned, much of the experiences here that the students have had and that we'd like to continue for them to have is that much of this is learner-driven. So and on the first day, in addition to getting to know each other and going over the structure, it will be a good opportunity for each of the preceptors to also, set the expectations in terms of again, what you're hoping for the students to work on, and what you will also be doing in terms of logistics for them. So again, for example, a good thing to go over is not only when to meet, but where to meet, but also when, and talking about the importance of basic things like professionalism, being on time. Timeliness is actually going to be a big component of this experience, since it is run on a pretty tight schedule, both for you and the students. So going over these basic kinds of expectations will also be something that will be a good opportunity for you to do on the first session at that initial huddle. So once everyone has settled in and everyone knows what to expect, you've generated your goals for the day, going to move on to the interview. So one thing that's good to do ahead of time before a patient comes into the room is to let students know that it is absolutely okay to call a timeout, especially because, as we talked about before, this is really their first experience doing these kinds of interviews in terms of psychiatric interviews with a patient. So it can often be helpful to have a subtle signal or a cue that you've worked out ahead of time between yourself and your students, so that they know that, again, if they need help, it's there. So with that being said, it is absolutely okay to to step in when they signal you for help, and perhaps to model a particular portion of the interview that they're struggling with. But it's important to remember that what's not okay is to jump in and do the whole thing. We want them to get the practice. We don't need it as much. So following the interview, which I'll show you a schedule at the end, usually will be between 20 to 30 minutes, depending on which week it is in the psychiatry ICE experience. After the patient leaves, we're going to give you and the students a chance to actually first work on writing out the mental status exam. I'm actually going to skip ahead real quick. First, they're going to work on writing out the mental status exam, and then basically practice, getting that down on paper. The first 2 weeks, the students are allowed to use a guided template, again, to help them get familiar and get used to the format of the psychiatry mental status exam. And then by the 3rd week, it's going to be important to ask the students not to use the template, so that they really start to feel comfortable with integrating what the mental status exam is independently. So once everyone's written the mental status exam out, then we're going to give the students a chance to get feedback. So as with all things Hofstra, the students are going to start with an opportunity to share and reflect on what the experience was like for them personally, in terms of highlights and what they felt they did well, and what they felt like they could improve on even further. After the student shares their experiences, we then like to open it up to involving the other students, as peer feedback is a key and critical component of the learning process. So what's important for you all to know is that the students are used to doing this in terms of giving and receiving feedback from each other. So it's important to, know that ahead of time, and let them know that everyone is welcome to participate, and it's a group learning process throughout. So then, again, if there's ever a little bit of a lag, you can always ask the other students, what did they think that the interviewer did well? And what did they think could have been done differently? Or perhaps was there anything that was missed? One thing that's really useful is that many of the students will come in with a checklist, an interview checklist that's provided in the manual. And we're also going to be asking students to come up with their own sort of cheat sheets, so to speak, in terms of key diagnostic criteria for things such as bipolar disorder, depression, schizophrenia, etc. So they can use these checklists and those guides in order to help guide their thoughts about how the interview went. So what's important is to give both positive and constructive feedback that's specific, it's objective, and it is important to, again, when we're talking about the constructive aspects, I always remember to phrase things not in terms of, what didn't they do or what did they do wrong, but again, in the frame that's mentioned here on the slide, such as what could have been done differently, or could there have been perhaps ways to improve even further on certain aspects of the interview. So I'm just going to go through here. So then after the interview feedback, then we get to the component of presenting the mental status exam. So here, we remind you not to assign the mental status exam presentation ahead of time. The idea is that the students who are observing the interviews should be fully engaged, and by not knowing who's going to be responsible for presenting, hopefully that will help the process along. So the thing is, after the interview has taken place, then you should, and after everyone's written out the mental status exam, only when you come to this part should you really invite one of the students who did not interview to give their presentation. After they've given the presentation, again, they can comment on how they felt that it went, and then following the same format, you can open it up to their peers, and then really let this segue pretty smoothly into a group discussion of the patient's mental status exam, and to use that, as learning points about, again, that particular patient's presentation, and perhaps time permitting, the diagnosis, although again, the focus is on the interview itself. So that's sort of one full cycle with one student interview. What we're going to do is ask you to repeat the cycle for each student, so that's for 3 students, during the majority of the Psych-ICE sessions. The only exception to this will really be during that very first Psych-ICE session, because that'll be an opportunity for you to first model an interview for the patient, with the patient for the students, so that they then can go full speed ahead on their own. After all of the feedback sessions following each interview has been completed, then the end of the day is going to be the debrief, where you literally want to ask them, right? What did you learn today? Do you have any specific questions? And you want to make sure that, once again, the goals for the homework sessions are really learner generated. You want to encourage students to come up with what are aspects of the interview process or mental status exam that they would like to learn further about, or about specific diagnoses that they saw, really anything related to the experience. But the key is that you want to encourage them to generate the goals. So, as some final logistical points, if there is a weather-related closure at the medical school, then Psychiatry ICE will automatically be canceled for that day, so we need to reschedule. Any missed ICE sessions do need to be made up, whether it's, again, related to the weather, or if you have a personal conflict that comes up. So for any reason, if an ICE session is missed, please make sure to contact both myself and Elizabeth if a student needs to make up a session, and we will work with you and unit attendings to find an appropriate day and time to make up the session. So just to end, I wanted to give you a brief visual on, again, what the schedules are going to look like. You have 2 separate, kind of clearly laid out templates for week 1 and then week 2 in your preceptor manuals. This is a visual just sort of combining the first 2 weeks for you. And again, basically the only difference between weeks 1 and 2 compared to weeks 3 and 6 is that week 1, a preceptor goes and does an interview, and then one of the students goes. And this, again, gives more time to really get into the swing of things, have time for the introduction and orientation, and just to help ease everyone in. To even things out and make sure everyone gets the same number of experiences with student interviews, that's why on week two, they will also again have 2 patient interviews in order to give a chance to the students who didn't interview the first week. So that way, by the end of the first 2 weeks, everyone will have interviewed a patient once. Following that, as you see here, the remaining weeks will compose of 3 cycles where essentially each student will have the opportunity to interview and present a mental status exam at some point during the session. So that is a wrap, and I want to open it up to any questions, comments that people have. In order to do so, you can type in your question into your into your computer, and we'll be able to receive the questions here.
Hi, it's Taranjeet. While we're waiting for questions to come in, I wanted to ask John if he could share a student story or a patient story from his experience, because he has served as a preceptor as well.
Putting me on the spot. I think for me what's been most memorable is how the students, many of them have never interacted with psychiatric patients before, and so there is and there's sort of this awe factor in terms of, wow, I mean, just things that we do day in, day out. They're like, wow, I never would have thought to ask that question, or, how do you sit with a patient like this? So it feels like most sessions feel like just really precious opportunities to be a part of each student really discovering something new, a new skill set, a new way of sitting, with psychiatric patients. So I'm getting a note here. So as I know, we have very knowledgeable participants today who may not have any questions. See here we have a nice note from someone saying no questions, all very clear, nice job. Thank you for that. Yeah, I think so. Aria just put a question in my ear, which is, so if you do have, sometimes this happens is, and you all have done this, so you know this, is you get to the unit and there's no longer 3 patients, and or you do a couple interviews and then one of the patients backs out, or they've gone to get imaging, or they're no longer in the unit for some reason. And I have found that the charge nurses and the nursing is just extremely helpful, as are the attendings. And often if you're on a unit where they're residents, they'll be really helpful. My approach has been just to ask for help from whoever I can find, and I've never had a problem ultimately been able to get a patient. So some of it's just perseverance and asking for help, and I think nursing, residents, attendings have been super helpful. So we have a question here. Will Aria be helping me getting patients on 8 Tower, or will I be responsible for getting the patients myself? That sounds like a question from our wonderful Saira Hussein. Yes. Aria, would you like to answer that?
Certainly. Hi, okay, this is Aria, and the answer to that is yes, I will be indirectly helping you with getting patients. It's good timing that you're asking that, as I just confirmed involvement of one of the attendings on 8 Tower as our official psychiatry ICE liaison for 8 Tower, and that will be Dr. Rosenberg on 8 Tower. He has agreed that he will be helping to ensure that patients are available for the session. So I will be putting you in touch with him. And I'm sure that you already interact with him quite a bit through consult, but I did just confirm today that he will be helping to make the experience go smoothly.
So directly it'll be Dr. Rosenberg, and anyone working on 8 Tower, you'll go there directly and find patients, work with him. One thing that has another question, thanks, wonderful. Also, can we ensure there is space for interviewing each week for the students?
And yes, I spoke with Dr. Rosenberg about that as well, and he will be ensuring that there is a room available for you. So that is confirmed that there will be space.
Great. One thing that Victor, Victor Frenari, if he were here, he would ask, or he may be here, is what if, sometimes you'll get a patient set up and it'll end up being a very short interview. That's okay. There's so much learning that can happen just if a patient can only tolerate a few minutes, or for whatever reason, there's always great debriefing and teaching that can occur. The goal here is we advise not to have the interview go more than 30 minutes and sometimes less, because you want to allow each student to interview and kind of go through this cycle of giving feedback. So what we want you to tell the students is really focus on introducing themselves, doing an HPI, asking the questions that they need to for the mental status exam, and then getting as far through the diagnostic interview as possible. But they may not finish with past medical history or past psych history or social history. That's okay. If they have a straightforward patient and they're a particularly skilled student, they might get through all of that, but most of them won't. And that's okay. So you really just want them to do the best they can on chief complaint, HPI, mental status exam, and then whatever else is fine. And I personally sort of tend to wrap it up around 20 minutes but you'll figure it out for yourself what makes sense in the room.
And this is Aria again, just to emphasize one point in terms of, as John was saying, in the interview component, one of the things that's really important is, again, really getting them to feel comfortable with completing and going through the HPI and review of systems. Now, for the mental status exam component, one thing that I know that students have said in the past is that as the psych ICE sessions progress, that they don't always necessarily write out the mental status exam, when they're practicing. And while it can be challenging at times, and it can feel like it might be easier to sort of just go through orally presenting it, one thing we did want to emphasize was to try to make sure that students do practice writing out the mental status exam, because it is something they will be assessed on after their ICE experience. So that's actually one of the reasons why we kept that in as far as a required component of the session experiences.
One more question, which is, can units in BHP have more room than Lowenstein? Any suggestions? Yes, that is true. My main suggestion, I guess I'm the one person here who's done it the last 2 years, is to work with nursing and getting the best room possible. Low 6 has been closed, right? And that was the most, and we're not using low 5. So those two were actually I thought the two most challenging units to find a room, and we're not using them this year. So it's low 3 and 4. And I thought actually low 3 and 4, I can't describe it efficiently, but there are rooms on low 3 and 4 they're cramped, but they were suitable, and nursing would let us in. sorry, may have missed this, but is 8 Tower a site for the preceptors, all preceptors, as logistically that may be a challenge? No, only a site for a few preceptors, and you would know if you are one of them. Is that a good answer?
Yes, this is Aria here. Yeah, that is correct. Those who will be going to 8 Tower, I've already been in touch with. So if I haven't been in touch with you, then that means you don't need to worry about it, and your units will always be on Hillside campus.
And I see a nice confirmation here from Victor Fornari, who confirms that 3 and 4 are fine. Low 3 and 4 are fine in terms of space. And it's great you're here.
I just wanted to, again, thank you all for joining us, and I'll pass the mic along to everybody so we can thank you. But we hope that you found this method more efficient. We didn't think that we needed to drag you all here, so we thought it'd be nice to have you join virtually, and let us know how this webinar worked for you, what didn't work, how we can improve the process for next year. Thank you again. Happy New Year. I'm going to pass it on to Aria.
Hi there. Just to echo Taranjeet, thank you again. And again, remember, it sounds like we will have plenty of opportunities to be closely in touch over the next several weeks. And please do not hesitate to contact me anytime with any issues that come up. I will do my best to be as available as possible. And on a logistical end, just wanted to remind you that this webinar is being recorded today, so it will be available in the next couple days, and we'll make sure to send out information.
One last thing I want to add is the Psych ICE student pairings will be released to both you, the preceptors, and the students this upcoming Friday, January 8th. So be on the lookout for that email.
There's a final question here. Can we schedule makeup dates on our own? The answer is yes. If you cannot do that, if there's, for some reason, you can't figure that out, then talk to Aria, Dr. Selman. All right, so that concludes our webinar. Thank you, everyone, for checking in and kind of getting refreshed on the goals and structure. You know, my main parting advice is to really try and stick with the structure and sort of on the general timing of it, because the students actually are going to get tested on their ability to do an interview and to do a mental SAS exam, and they'll start to get anxious if they know what the structure and expectations are, and they actually will get anxious if you're not following it. Having said that, each of us obviously has our own style and will improvise in ways that will enhance the experience. Thank you, and look forward to seeing you all in the next few weeks.